Thank you so much to everyone that subscribed to my channel. Thank you for watching my video as well. Well, as a form of introduction, my name is Matilda Samuel. I'm a pharmacist and I'm passionate about people taking their drugs the right way to ensure safety and to prevent drug abuse. One of the reasons why I created this channel, so I can reach out to a lot of people. You're welcome once again to everyone that's seeing this video for the first time. Thank you so much for watching. Ensure you stay to the end as I have juicy stuff for you guys. Okay, so I'll dive right into it. I've had a couple of people that have been hypertensive for a while now, and I've noticed that they keep taking their drugs and it's not working for them because of some things that they do that are not actually healthy for them. And so I'll be putting it right out here. So if you have a friend, a colleague, a neighbor, someone you know who is hypertensive, do share this video with them and encourage them to change their lifestyle for their own good. So you may be taking drugs for hypertension for a number of years and you're not seeing improvement, that you're actually taking those drugs the way you're not supposed to. So next time you visit your doctor, your pharmacist, ensure to listen to instructions so you can take as you're supposed to. There are different hypertensive agents, the different drugs out there used in the management of hypertension, and they're taken in different ways. So you don't meet your neighbor and take the same way your neighbor is taking. You're supposed to take as instructed. Okay. Secondly, a lot of people take these drugs and do not bother to check their blood pressure. So if you're taking an anti-hypertensive, it is the right thing for you to actually check your blood pressure as you take these drugs, so you know if your drug is actually working. Because if the drug is working, then the blood pressure should be coming down if it was high, But if you're not checking and you're just taking, you could actually take those drugs to your own detriment. So ensure that as you're taking your drug the right way, you're checking your blood pressure at least once in a week, or you're going back to the hospital for a checkup as instructed by your doctor. Thirdly, the foods that you eat. Okay, so now we I don't know if we know, but salt is not good for people who are hypertensive. You shouldn't take a lot of salt. Why? Because it increases the blood pressure. So if you're hypertensive, you're taking drugs and the drugs are actually working, but you're not eating the right way, your blood pressure is still going to go up. So what do? Be careful not to add too much of salt in fact, be careful not to add salt to your food. There are a lot of people cooking healthy, eating healthy without adding salt to their food, and their food is still nice and tasty. I recommend Lagos Housewife. I recommend Sherry Mama's Delight. Both of them are based in Lagos. They even have YouTube channels. So do check out their YouTube channels and find out how they make those foods without seasoning cubes, without salt. But there's one that is healthy. There's a kind of salt that is actually healthy, and it is known as sea salt. So look out for sea salt and use it in small quantities in your food. The truth is, most of our natural seasonings that are not processed, are not chemically preserved, actually contain a little amount of salt here and there. So you really do not need to use a lot of salt. I even know some people, even after they've cooked the food, they will now still want to warm the soup and still put raw salt. It's not the right thing to do. Sir and ma, please ensure that you cut down intake of salt. Just keep cutting down until you can finally do without it. Or check out those two people I just recommended to you and start immediately to use natural seasonings for your cooking. It would go a long way in helping your blood pressure to become normal. Thirdly, water therapy. A lot of us do not take water. Let's leave the people that don't take water. Now I'm focusing on hypertensive patients. Water therapy is one of the things that is very good for you. So ensure that you take water as soon as you wake up in the morning. It's important. It's not an easy thing to do, but if you're actually concerned about your health and you want to get better, then you need to incorporate it into things that you do daily. So you wake up in the morning and you take water. Take water as much as possible all through the day. It helps a whole lot. So I've seen hypertensive patients that have been weaned off their drugs gradually by incorporating these things. So the first thing I said was know your drug. What kind of drug are you taking? The drug you're taking is not the same as your neighbor's own. Your blood pressure, it's not as high as your neighbor's own, or it's not lower than your neighbor's own. The doctor or the pharmacist that took your blood pressure and recommended you to take drugs knew what he was saying when he gave you that instruction. So please go back to them. If you have forgotten how you were supposed to take it and you consulted your neighbor, your sister, your brother, please and please, your situation is not the same as your neighbor's own. So find out from your doctor how it was prescribed for you to take. Find out from the pharmacy, wherever it was that you got your first treatment plan from. Please go back to how you were supposed to take. If it was once in a day, be faithful to it. If it was twice in a day, do that. So know your drug. Know your drug. Know the name. Know the side effects. Know when to take it. Am I supposed to take it in the night? Am I supposed to take it in the morning so it is effective? All of those things actually matter and help your drug to work well. So find out and start to judiciously take your drug as you are supposed to. While you're at it, check your blood pressure. That was the second point I made. Check your blood pressure. Check your blood pressure as much as possible so you know. Because it gets to a certain point, if your blood pressure is normalized and you keep taking the drug, it is detrimental to you. So check your blood pressure. It is very, very important. Check your blood pressure. That was the second thing I mentioned. The third thing I talked about was be careful of what you eat, especially salt. Please take salt out of your cooking. Take salt out of your, most of these processed, chemically preserved seasonings are not healthy for you. So use sea salt or find out other natural seasonings that you can actually use to cook your food without adding salt so you can stay healthy. And then the last one I talked about was water therapy. If you have not started doing it, as you watch this video, please start doing it now. Take a lot of water, as much as you can. There was something I forgot. Let me quickly add. If you're on the big side, like your let me not say you're fat, like you put on a lot of weight, you need to start losing weight because it's not good for your blood pressure. As fat as you are, it can actually affect your blood pressure. So start thinking of how to lose weight the natural way. Start thinking of how to lose weight. You cannot afford to be on the big side if you're hypertensive. It increases your blood pressure. So I hope that these things do help you and you actually put them into practice. It's not just about watching the video, it's actually about you putting it into practice and seeing results for it. So I would love to get feedbacks from a lot of you. If there's anything you do not understand, please drop your questions in the comment section. Also, if you feel like there's something else you can add to this video, you're a health practitioner, a doctor, a pharmacist, I will gladly appreciate it. So thank you so much for watching this video. If this video added anything to you, please like this video. If you know of people that actually need this information, share with them. And lastly, do not leave without subscribing to this channel. Thank you so much for watching. I really do look forward to testimonies from people. I look forward to feedbacks from people, and keep watching. Let's stay connected. Thank you so much to everyone that has liked this channel already, that has shared this information, and that has subscribed. I really do appreciate it. I don't take it lightly. Thank you for listening to me. I remain your farm guide, and I remain committed to bringing you information that can help you and that can keep you safe even while you're on drug and prevent you from abusing your drugs. Okay, I'll be taking my leave now. I see you in the next video. If there's anything you would like me to talk about as concerns your drug, please also drop it in the comment section and I'll do my bit to talk about it as I can. Do have a lovely, lovely day. Bye.